I think a lot of folks felt like it was kind of like being kicked when you're down.
One pandemic compounded by another one.
If it is not a public health emergency, it is a police, it is a lack of opportunity. So we have so much trauma that we deal with every single day, and many people do not know, do not understand.
For Black, Indigenous, and people of color in America, the precarious threat of losing life, financial stability, and community has existed for decades.
Coronavirus just highlighted it, that emotionally people of color are drained, they are tired, and they've been waiting for the light at the end of the tunnel for so long.
In 2020, the coronavirus pandemic exposed those racial disparities, especially in healthcare. People of color are 2 to 5 times more likely to be infected with or die of COVID. The mental toll is also steep, especially amid racial tensions. Licensed clinical social worker Alyssa Brown says the Black community is in a state of grief.
Grieving, the grieving folks that we've lost, family and friends that we've lost, you know, people that we know personally, and, the folks, again, who have been lost their lives to police brutality and who were, murdered.
Susanna Davis, Vermont's first racial equity director, says people of color tend to have poorer mental health outcomes than white people due to structural, social, and economic barriers.
We know, for example, that in Vermont, Indigenous people in 2015 were being diagnosed with depression at a rate of 1 in 3, compared to white Vermonters who were being diagnosed at a rate of about 1 in 5.
Davis says there's much work to do on the city and state level.
Of course, everything we're talking about here is inextricably linked to other sectors. So we can't talk about public health campaigns without also talking about public education. We can't talk about school discipline without talking about criminal justice, traffic stops, school to prison pipeline.
And Brown says practitioners in the state are also making changes to the way they treat Black and brown clients, such as working to be more culturally humble and addressing the financial burden of therapy. Reporting, Aaron Brown, Channel 3 News.